Good morning, my name is Tiffany and I'm going to be your nurse today. Can you tell me your name and age?
Taylor Jones. I'm 29 years old.
You're 29? Okay,
Yes.
good. Today you're in for a respiratory assessment, so we're going to be listening, we're going to be touching and tapping to see how everything is going, okay?
Okay.
Do you have any questions for me before we get started?
No, ma'am.
Okay, so the first thing I'm going to do is I'm going to take a look at your chest and I'm looking for the contour and the symmetry just to make sure everything is equal. And then we're going to look at the anterior, posterior, transverse ratio to make sure that that's 2 to 1, which it is. And I'm going to turn around and I'm just going to look at it one more time. Posterior, anterior, transverse is 2 to 1. So the next thing we're going to do is I'm just going to have a look and inspect the symmetry and expansion to make sure everything is equal. I'm going to feel your scapula and your spine to make sure that it is centered down the back, which it is. And the next thing I'm going to do is I'm going to palpate for some tenderness. So I'm going to feel and you tell me if anything hurts in any of those areas, okay?
Okay.
I'm out of breath. Okay. In here?
No.
Here?
No.
Here?
No.
Here?
No.
Great. So the next thing I'm going to do is assess for tactile firmitis. So I'm going to place my hands as you say the words 99 just to see if I can feel some vibrations, okay?
Okay.
Okay?
99, 99, 99, 99.
Great. So the next thing I'm going to do is I'm going to assess your lung expansion. So I'm going to place my hands right here and I want you to blow all your air out. And now take a deep breath in. Great. We're just making sure that your lungs expand equally, which they do. So the next thing I'm going to do is I'm going to percuss your lung fields to see if I hear any resonant sounds to make sure you have good air.
Okay.
Okay? Thank you. Okay, great. The next thing I'm going to do is take my stethoscope and I'm going to listen to all those same places that we just tapped. So
Okay.
every time you feel my stethoscope, take a little bit of a deeper breath than normal, okay?
Okay.
Okay, great. So the next thing we're going to do is we're going to turn around and I'm going to take a look at the front of your chest. So the first thing I'm doing is making sure that you are not using any of your accessory muscles to breathe, that you're not having any difficulty with that, which you're not, so that's great. And then the next thing we're going to do is we're going to assess for tenderness just like we did in the back.
Okay.
So when I feel, you tell me if you feel any pain or tenderness.
No. 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 No.
Okay, great. So the next thing we're going to do is the tactile firmitis. So I want you to say 99 again.
99, 99, 99, 99.
Great. And then the next thing we're going to do is percuss. So we're going to tap and hear for those lung sounds just like we did on the back, okay?
Okay.
Turn right here. Okay, great. And now we're going to listen to those same areas.
Okay.
So just take a deep breath every time you feel. Okay, Taylor, everything sounds good. Do you have any questions for me?
I do not.
That concludes my assessment.
All right, thank you.